Hello, my dear doctors. Welcome back. Hello, my dear doctors. Welcome back here. This is Dr. Azam here, your faculty of anatomy at PrepLadder. And today in this session, we are going to discuss about the LRR session of INI-CET. So we are going to discuss all the high-yield topics. And especially this session is based on the PYQs, the previous year questions and the previous year concept that has been asked in your INI-CET exam. A very good evening to all of you. I'm just seeing in the chat box here. Yes, a very good evening, Dr. Jairaj. A very good evening, Pratyush. Very good evening, Rahul from Nepal. Thank you. Thank you, Himanshu. Same here. So very good evening to all of you. So in this session, mainly this session is actually concentrating on the students who are going to appear for this INI-CET exam, the upcoming INI-CET exam, and it is mainly based on all the concepts that has been tested again and again in your INI-CET exam, and we are going to discuss all those previous year topics over here. And along with that, not only just retaining or pertaining ourselves to only the previous year concepts, we are also going to discuss like other high yield concepts also which are expected in your exam. So let's get started with the session here. Yes, my dear friends, just confirm me everyone here, like is my audio and video everything is perfectly fine? Yeah, Abu Bakar Ahmed, thank you. I'm good now. Good to go with the work now. Yes, sir, all good. Fine. Thank you. So as usual, according to the way I conduct the LRR session, it's not just about certain questions that I'm going to discuss or certain topics. We are going to discuss like all the topics of anatomy, like one by one. We'll be starting with the most difficult ones like neuroanatomy and head and neck. Then we'll start with the limbs, upper limb and the lower limb, then thorax, abdomen, pelvis and perineum. And of course, we are also going to discuss embryology part along with the histology and joints also. So in this manner, we are going to do the entire anatomy. So just be comfortable, have your water and coffee along with you. Let's get started with the session. Okay. So the first thing, the first topic that we are going to start is actually the neuroanatomy. And what I have done in this session is that, majority of the things are actually written there. Because this is almost like, it's not even like rapid revision now. It's like LRR, last resort revision. That is the reason why everything almost has been written in the PPT or PDF here. And the only thing is that you need to just focus on recalling all the concepts here. Fine. So let's get started right now. The first concept that we are going to discuss here. The first concept that we are going to discuss is about the Broadmann areas. And along with that, we are going to see about the aphasia. Now, point number one, every medical student should know that somewhere here you'll be having area number 44 and area number 45. And this area number 44 and 45 will be the Broca's speech area. Broca's speech area here. So now we are done with the number 44, 45. We are done with the name Broca's speech area. What is the location? We can clearly see it is located in the inferior frontal gyrus. That's in the inferior frontal gyrus. And we all know very well the Broca's speech area will be the motor area. And somewhere here will be your area number 22, then 39, and then there will be 40 here. And this one here will be the Wernicke speech area. And Wernicke speech area will be the sensory area. Sensory area here. Fine. By which they will be like, you'll be able to understand the spoken language and all those things. Comprehension will be there. Now these two, that is Broca's and Wernicke speech area, these two are connected by this fasciculus. Even this was also a previous year question. This is known as the arcuate fasciculus. The Broca's and Wernicke are connected by the arcuate fasciculus over here. Now suppose if there is a lesion in these areas, then what is going to happen? Now, for example, if there is an injury in the Broca's speech area, then the person will not be able to speak because it's a motor area. The person will not be able to speak, but he will be able to understand everything. Now, similarly, for example, if there is a lesion in the Wernicke speech area, then what is going to happen? The person will be able to speak here, but he is not able to understand anything over there. Fine. And now what is going to happen if suppose arcuate fasciculus is gone, then the repetition will be actually a problem here. Now, this speech disorder is actually referred to as aphasia. Yes, if there is an injury or lesion in the Broca's speech area, then it is nothing but Broca's aphasia or motor aphasia. If there's an injury in Wernicke speech area, there'll be Wernicke aphasia or sensory aphasia. Similarly, if there's an injury in the arcuate fasciculus, it will lead to conduction aphasia. If all the three are gone, then it will be referred to as global aphasia. It will be referred to as global aphasia. Fine. Now, one more important MCQ here. We know very well this one here will be the frontal lobe here, and this is the temporal lobe here. Between these two, the sulcus that you are able to appreciate here will be the lateral sulcus. Now, this sulcus here will be the lateral sulcus, or else this sulcus is also referred to as Sylvian fissure. Sylvian fissure. Fine. Now, in this sulcus, there will be an artery passing from here, and that artery will be actually the MCA, that is middle cerebral artery. And if there is a stroke of this middle cerebral artery, of course, it will lead to what? Aphasia. Even this artery, you have to remember here. If there is a stroke of this artery here, then the blood supply to this area will be lost. It will be leading to the speech disorder, that is aphasia. I hope there is like crystal clear concept here. Now, once you are done with this first concept here, let us go to the next concept. Now, before starting with this concept here, my dear friends, listen to me very carefully. Now, I'm going to teach you about all the three sections of the brain. I mean to say, we are going to see the brain in coronal section, and then we are going to see the brain in sagittal section as well as the transverse section. And believe me, in the exam, there will be a question regarding the section of the brain. Without the section of the brain, the exam paper will not be completed. So please remember that one. Okay. So now the first section that we are able to see here will be the coronal section. And along with the coronal section, I'm also going to teach you about the lateral ventricle. Now, the moment you look at this diagram here, you're able to appreciate that there is one lateral ventricle here, and there is another lateral ventricle on the other side. And both of them, of course, they are separated by a septum in the middle, and that is septum pellucidum. Now, these two lateral ventricles will be opening into the third ventricle with the help of a foramen. That foramen will be the foramen of Monro. Okay, so the lateral ventricles will be continuing into the third ventricle via the foramen of Monro. Fine. Now, the first thing that you have to appreciate here is, yes, the right and left half of the brain are connected by this bundle of fibers here. And this bundle of fibers which are going to connect the right half and left half of the brain, that will be referred to as commissural fiber. And this will be the largest commissure. And this one here will be the corpus callosum. That is corpus callosum. And you can very clearly see in our diagram here, corpus callosum is the one which is going to form the roof of the lateral ventricle. Perfect. Then between the two lateral ventricle, I told you that there will be a septum here, and that septum will be the septum pellucidum. And septum pellucidum is the one which is going to form medial wall, the medial wall of the lateral ventricle. Now, once you are done with these two here, the next thing here, my dear friends, remember this nucleus here will be the caudate nucleus. Then there'll be a vein here. This vein here will be the thalamostriate vein. And then after that, this network of capillaries present over here will be the choroid plexus here. And finally, this one here will be the thalamus. Now, this one here will be the thalamus here, sir. So I repeat again, everyone here, my dear friends. Now, the first of all, this nucleus here will be the caudate nucleus. Followed by that, you'll be able to see a vein in the middle, that is thalamostriate vein. And then you'll be able to appreciate the choroid plexus here, that is a network of capillaries there. And then you're able to see the thalamus. Then now the most important thing is, in the middle of these two, I told you there'll be a septum, that is septum pellucidum here. If you see the lower margin of that one, attached to the lower margin of this one here will be the fornix. Now this one here will be the fornix, and that is extremely important for your exams. Now all these structures together they are going to be present in the floor of the lateral ventricle. They're all present in the floor of the lateral ventricle. I repeat again, the caudate nucleus, thalamostriate vein, thalamus, choroid plexus, as well as the fornix, all of them are found in the floor of the lateral ventricle. I hope now you're understanding what I was telling you in the beginning, my dear friends, that in this session, we are not going to like write much here. This is like LRR. We are going to do it very quickly. It's all about like recalling everything. So if you are able to recall all these structures, that means you are on the right track. Is it okay? Now, once you are done with all these things here, my dear friends, just to finish off this diagram here, this nucleus here, the lens-shaped nucleus will be the lentiform nucleus. And passing in the middle here, these fibers will be the internal capsule. That is the internal capsule. And this black colored pigmented substance here will be the substantia nigra. Substantia nigra. So that is something like really important to remember in this coronal section of the brain. Now, once you are done with this one, let us discuss about the Fornix in detail here, my dear friends. This is like hot favorite topic of your INI-CET examiner. Fornix is one of the hot favorite topic in INI-CET, and you can always expect a question from here. Please look at the screen here. First of all, in this diagram, you're able to appreciate here that there will be hippocampus here. And from the hippocampus, follow this red colored line here. It is a Fornix, and that will be going and joining with mammillary body. Now from the mammillary body, there will be mammillothalamic tract, and that will be joining, of course, with the thalamus. And the question asked in the exam was with which nucleus of thalamus? And remember, it will be the anterior nucleus of the thalamus. So please remember this one statement here. From the hippocampus, Fornix is going to begin, and that is going to go all the way up to the mammillary body. Now from the mammillary body, there will be mammillothalamic tract, and via this mammillothalamic tract, it is connected to the anterior nucleus of thalamus. That is important. Anterior nucleus of thalamus. So if you remember this one statement, many a times in your exam, the question has been asked from here. Please take care about that one. Now after that, about the Fornix, I'll tell you like 3 MCQs here. Number 1, I hope you all know that white matter will be divided into like 3 categories here. Association fiber, commissural fiber, and projection fiber. Now the question was, out of all this, that is association, commissural, and projection fiber, remember, Fornix belongs to all the above. So in the option, if all the above is given, please go for that option. Fornix belongs to association, commissural, as well as projection. No, sir, if you want any one best answer here, association will be a better answer when compared to commissure, when compared to projection. So if you want any one best answer, then association fiber will be the best answer. But recently in one of the exams, they have asked the combination of this one. Remember, better combination will be association and commissural fiber, not the projection. Is it okay? In Gray's Anatomy, actually, Fornix is not included in the projection category. So from that reference, we can say that it will be actually the best combination, that is association and commissural. So 3 MCQs are actually done here. Let me repeat that once more here, and it's worth repeating here. Remember, Fornix belongs to all the 3 types of fibers: association, commissural, and projection fiber. If you want any one best answer, the best answer will be association fiber. If you want any best one combination here, association and commissural will be the better combination here. I hope this concept is like crystal clear now. Now, once you are done with this one, let us go to the next one. That is the sagittal section. Now, in the sagittal section, along with this one, we are also going to learn about the third ventricle. Now, in this diagram, if you observe here, this one here will be your third ventricle here. Now, if this is the third ventricle, what is going to first of all form the lateral boundaries of this one? What is there on the lateral side of the third ventricle? Lateral side of the third ventricle is formed by thalamus here, and below the thalamus, this part here will be the hypothalamus part here. And you can actually remember this from our last diagram itself here. I told you very clearly in this diagram, this one here will be the third ventricle. And what is there on either side of the third ventricle? What is forming the lateral boundary? That is thalamus here. And below the thalamus, of course, there will be hypothalamus. Makes sense. Lateral boundary is done. Now, similarly, what is going to form the roof of the third ventricle? Roof of the third ventricle will be formed by choroid plexus, and then there will be the fornix. Okay, choroid plexus, and there should be fornix. So please look at this diagram here. Of course, the roof of the third ventricle is actually formed by the choroid plexus over here and the fornix above that one here. Above that fornix here. Now, I'll tell you one more thing here, my dear friends. If you want to learn like conceptually here, just follow this order. I told you this one here will be the third ventricle. Just above the third ventricle, there is choroid plexus. And then you'll be having fornix here. What do you have above that one? That will be the septum pellucidum. मैंने आपको already बता रखा है. If my hand here is like septum pellucidum here, just below, the lower margin of that will be attached with fornix there. तो fornix के ऊपर क्या होगा? What is there above the fornix? This is septum pellucidum here. And above that, corpus callosum. Please let us do it once more here, because this was just a previous INI-CET exam question. Okay, now So this is the third ventricle here, above that choroid plexus, above that fornix here, then septum pellucidum, and then the core and the corpus callosum. So if you remember that sequence, obviously, my dear friend, this is third ventricle here. Just above the third ventricle, there will be choroid plexus here. Above the choroid plexus, there will be fornix here. Above that, this septum has to be the septum pellucidum. That is what I'm trying to tell you here. This is septum pellucidum, and this was asked in the last INI-CET exam only. That is septum pellucidum. And above that, this one here will be your corpus callosum. No doubt about that one. And you can clearly see the four parts of the corpus callosum. There will be rostrum here. The bent in the front will be genu, and then there will be body, and finally this is the splenium part here. We know that very well. Okay, now, so please remember that sequence very much carefully. Now, once you are done with the roof, what is going to form the anterior wall of the third ventricle? So third ventricle here, anterior wall is formed by anterior commissure here, followed by this lamina, that is nothing but the lamina terminalis. Now I want you to remember like 2 points regarding this lamina terminalis. Remember, it is the place where you don't find any blood-brain barrier. There will be no blood-brain barrier at the lamina terminalis. And this lamina terminalis is actually representing what? Remember, it is actually the remnant of anterior neuropore. It is actually the remnant of anterior neuropores. Fine. Now, once you are done with the anterior wall, welcome to the posterior wall. Posterior wall पढ़ने का तरीका क्या होगा? First of all, you should be able to identify this gland here. This gland here will be the pineal gland. Now, above the pineal gland, there is a commissure, that is habenular commissure. Below the pineal gland, there will be commissure here, and that will be the posterior commissure. First, there will be pineal gland. Above that, there will be habenular commissure, and below that, there will be, yes, posterior commissure. And then finally, this duct here will be the aqueduct of Sylvius. All this together, they're actually going to form the posterior wall of the third ventricle. Now, finally, after all this, we are just left out with the floor of the third ventricle. Now, this crossing here will be the optic chiasma. And then followed by that, this is infundibulum, nothing but the pituitary stalk. Along with that infundibulum, will be also having tuber cinereum there. And this body here will be the mammillary body. And this is the posterior perforated substance. And this will be the tegmentum part of the midbrain. We all know very well this entire thing here will be the midbrain here. In the midbrain, there will be aqueduct of Sylvius passing from here. And that is an important landmark. Whatever part you find behind the aqueduct, this is the tectum part, and the part that you're able to find in front of the aqueduct, this one here will be tegmentum part. And all the structures together they are actually going to form the floor of the third ventricle. So all that structures will be actually going to form the floor of the third ventricle. So in this manner, my dear friend, very much conceptually and without even wasting your much time, we are done with the sagittal section. All the structures are completed here. I hope you're understanding and planning here. That is the reason why I'm not wasting the time here in writing everything over there. Yes, I have made like maximum things possible already written there. 80 to 90% is written there. I want you all to sit there, relaxed. Don't worry about writing well apart and you're missing the things. Apply the concept, see the logic, see the tricks that I'm telling you here, and try to retain them in your mind at this last moment before the exam. I hope you're getting my point right now. Okay. Now, once you are done with the sagittal section, let us go to the last section here. There is a transverse section here, my dear friends. Now, in this transverse section, first you need to understand the orientation. To understand the orientation, please look at this small diagram here. Now, in this small diagram, whatever that green colored part is highlighted, that is your corpus callosum. And corpus callosum, just now I told you, they are like 4 parts: rostrum, genu, body, and the splenium part here. Right in front of the genu, you're having the frontal lobe here. And behind the splenium, there will be the occipital lobe here, sir. Okay, fine. We got the orientation here. Now we are going to cut the brain in transverse section like this here. And then I'm going to remove all the part from above. And then we are going to look from above. Okay, so I'm going to cut the cerebrum in the transverse section, and then we are actually going to look from above. हम ऊपर से देखेंगे. So when you're going to look from above, this is how the diagram looks like. Now in this diagram here, there will be genu present over here, and right in front of the genu, there will be a frontal lobe here. And then there will be splenium present here, and right behind the splenium, there will be occipital lobe here. Okay. Then you're able to see here that there will be white matter fibers which are going to connect the genu with the frontal lobe. The white matter fibers connecting the genu with the frontal lobe, and that will be forceps minor. And the fibers which are connecting the splenium with the occipital lobe here, this will be the forceps major. And just now we have seen in our diagram here, the genu and the splenium are connected by the body here. Similarly, the genu and the splenium are connected by the body here, sir. Okay, now from that body, you need to understand there are certain fibers which are going to connect the cerebral hemisphere on either side. And those fibers are referred to as tapetum fibers. There will be tapetum fibers here. But now, please be careful. This question was actually given in your exam. The tapetum fibers are going to arise from body, and few fibers are also coming from the splenium. So if option is given there, the tapetum fibers are rising from where? Don't mark only body. Remember, it is body as well as the splenium part there. Done? Now, once you are done with the anterior part here and the posterior part here, welcome to the middle part. Now, in the middle part here, first of all, this nucleus here will be the caudate nucleus. And then you'll be having thalamus. And then this one here will be the lentiform nucleus. Now, once you are able to identify all these nuclei, between the caudate, thalamus and the lentiform nucleus, these fibers here, the white matter fibers here, this will be referred to as your internal capsule. Now, exactly in the similar manner, on the outer part of the lentiform nucleus, you'll be able to again see the white matter fibers. And this one here will be the external capsule. And then finally, again, you are able to find one more sheet of white matter here. And this one here will be the extreme capsule, my dear friend. Now, between the external and extreme capsule, you are able to find a sheet of gray matter. And this gray matter here will be referred to as claustrum. And further, if you're going to come out here, you're able to see this hidden lobe of the cerebrum. And this one will be referred to as insula. Insula, even that was given in the image-based question. So you got to remember all the structures present over here, like in sequence from the medial towards the lateral side, sir. Is it okay? Now, once you are done with this one here, of course, all these nuclei present over here, they are a part of your basal ganglia. This caudate nucleus here, lentiform nucleus here, they're actually a part of your basal ganglia. And in the middle of that, this white matter fibers present here is nothing but your internal capsule. So let's see these two topics right now. Now, first of all, let's get started with the basal ganglia. Basal ganglia is mainly made up of like three parts here, sir. Remember, number one, there will be corpus striatum. Number two, there will be subthalamic nucleus. And number three, there will be substantia nigra. So number one, there will be corpus striatum, which is present in the telencephalon, in the cerebral hemisphere. Number two, there will be subthalamic nucleus. From the name itself, we are able to understand subthalamic, that is present below the thalamus. And where is the thalamus present? In diencephalon. So therefore, the subthalamic nucleus is also found in diencephalon. And then substantia nigra, that is actually present in the midbrain. That is nothing but mesencephalon. Now, this corpus striatum is in turn made up of two nuclei, the caudate nucleus and the lentiform nucleus. Lentiform nucleus is in turn made up of two nuclei, that is your putamen and the globus pallidus. This is what you have to remember. Aram se recall karte jaiye. I know that you people have gone through all the main videos and you will have already gone through the rapid revision videos at least. Okay. So don't worry, just try to recall all the things right now. Now, once you are done with all the parts of the basal ganglia, yes, of course, you're able to see here. In this one here will be the caudate nucleus here, and this one here will be the lentiform nucleus. And just now I told you, lentiform nucleus is in turn made up of putamen and globus pallidus. And please remember, the putamen will be on the outer part here, and on the inner side, you'll be able to appreciate the globus pallidus. I mean to say, globus pallidus will be more medially placed, whereas putamen will be on the outer side. Now, apart from that, my dear friends, remember, yes, the clinical application of this one. What is a site of lesion and what is a movement disorder? If there is a lesion in globus pallidus, remember this will lead to athetosis. Similarly, if there is a lesion in putamen and the caudate, it will lead to chorea. Substantia nigra, everyone knows very well, it will lead to what, guys? Parkinsonism and Parkinson's disease. And subthalamic nucleus, if there is a lesion here, it will lead to hemibalismus. Already this has been asked in your exam. I mean to say, in the exam, they have actually asked in a vice versa manner. If chorea happens, if chorea occurs, then the parts of the basal ganglia which are involved here, please remember the two parts, that is putamen and the globus pallidus. These two parts will be involved in chorea. Hemibalismus, the part of the basal ganglia which is involved here, will be the subthalamic nucleus. So please remember this clinical application. We are done with this one here. Now in the middle of all this nuclei, you were able to see the internal capsule. Now first of all, how many parts do you have in the internal capsule? Remember, there are totally like 5 parts of the internal capsule. There will be anterior limb, there will be posterior limb, there will be a bent in the middle, that is genu, and then you'll be having sublentiform part and the retrolentiform part here. There are totally 5 parts in the internal capsule. So in this diagram, you're able to appreciate here the fibers which are passing. This is nothing but your internal capsule here. And in this one, there will be anterior limb here, the bent in the middle genu here, the posterior limb here, and you're able to see this is lentiform nucleus. The fibers which are going to pass below this one here, sublentiform, and behind retrolentiform. Perfectly makes sense. There are totally like 5 parts of the internal capsule. Now, once you are done with the parts here, you also have to learn the relations of that one. You can very clearly see in our diagram here, if this is the internal capsule here, on the lateral side you're having a lentiform nucleus, and on the medial side you'll be having the caudate and thalamus. I repeat this once more here. On the lateral side there'll be lentiform nucleus, and on the medial side there'll be caudate and the thalamus. Now the most important thing that you have to learn for your exams is what are the tracts which are going to pass through the internal capsule. Number 1, through the genu. Now through the genu, remember, there will be corticonuclear tract passing from here. This is the one which is going to pass from the genu part here, and corticospinal tract, you can very clearly see it is going to pass through the posterior limb. But remember, in your INI-CET exams, I've already asked that yes, it is going to pass through the anterior 2/3 of the posterior limb. Please remember, in the INI-CET exam, it is going to pass from where? From the anterior 2/3 of the posterior limb. So I repeat again, corticonuclear tract is going to pass from the genu part, whereas the corticospinal tract is going to pass from anterior 2/3 of the posterior limb. Perfectly done, sir. So in this manner, we are done with all the points that you have to revise about the internal capsule. Now, once you are done with this one, welcome to the next, another very important topic, my dear friend, that is brainstem topic. In this diagram, we are able to see the ventral aspect of the brainstem. And needless to say, we know very well, the brainstem is made up of midbrain here. This big bridge-like structure will be pons here, and this part here will be medulla. Midbrain, pons, and medulla, all these 3 together are referred to as your brainstem. Now, on the ventral aspect of the brainstem, you should be able to identify the cranial nerves which are going to begin from here. So please remember, the cranial nerve number 3 and the cranial nerve number 4 are going to begin from the midbrain. The cranial nerve number 3 and 4 are coming from the midbrain, my dear friend. Now, out of this, please observe the diagram very much carefully here. The 4th nerve is the one which is coming from behind. Now, why I'm stressing on this point here? Why? Because your INI-CET examiner loves this a lot. Remember, out of all the cranial nerve, the only cranial nerve which is going to originate from the dorsal aspect, from the dorsal side, that will be the 4th nerve, sir. You can see all the remaining cranial nerves are going to originate from the ventral aspect. The only one which will be having dorsal origin will be the 4th nerve. The one which is having the dorsal origin will be the 4th nerve. So it is going to originate dorsally, then take a turn and come in the front. And remember, my dear friend, because of that reason, because it is going to take a turn and come in the front, it is the one which is having longest intracranial course. It is traveling the longest inside the cranium, longest intracranial course. And of course, it is the smallest one and the thinnest one. Clear? These are all the points you have to remember about this. Now after this, in this diagram, you're able to see this cranial nerve coming from the pons here, and this will be the cranial nerve number 5. That is your trigeminal nerve. And trigeminal nerve, to be very much specific here, it is coming out between the pons here and the middle cerebellar peduncle here, sir. The pons and the middle cerebellar peduncle, in between them, it is going to exit out. That is your 5th nerve. Now, between the pons and medulla, this junction here will be referred to as pontomedullary junction. And right at the pontomedullary junction, you'll be having cranial nerve number 6, and then there will be the 7th one, and then you'll be having the cranial nerve number 8 at the pontomedullary junction. Now in the medulla oblongata, this elevation here will be pyramid and pyramid here, and this will be olive and olive here. Lateral to olive here, this is the 9th nerve, and this is the 10th nerve, and this is the 11th nerve here. Between the pyramid and olive, this one here will be the 12th nerve. As I told you, all the cranial nerves are going to originate ventrally except the fourth nerve. Fourth nerve will be actually having the dorsal origin. Is it okay? Now, once you are done with this one here, what was the MCQ which has been asked in your exam? Now, first thing that you have to remember that the cranial nerve number 9, 10 and 11 will be having a common nucleus, and that nucleus will be the nucleus ambiguous. Now, apart from that, exactly this image was given, and they have given that there is an injury at this point here. At this point, there is a lesion. If there is an injury here, then what is going to happen? Now, my dear friend, try to understand here that elevation pyramid is actually formed due to pyramidal tract here. Okay. This elevation pyramid is actually formed due to pyramidal tract here. Now this pyramidal tract is going to descend down, and almost like 85 to 90% of the fibers are going to cross on the other side. Okay. Remaining 10 to 15% of the fibers are going on the same side. Fine. Okay. You can even appreciate the crossing here. Look at this diagram very carefully. You are able to see the fibers of pyramidal tract crossing there. That is referred to as pyramidal decussation. And please remember, this itself is like a repeated question in your INI-CET exam. Where exactly will the pyramidal decussation take place? Remember, pyramidal decussation will be taking place at lower medulla. Pyramidal decussation will occur at lower medulla. Already this question has been asked many times in your INI-CET exam. Point number 1 completed here. Done. Now, pyramidal tract, you all know very well, it is a corticospinal tract. Another name of this one is corticospinal tract, and that is a descending tract. Descending tract is going to carry the motor information. If this tract is injured, of course, it will lead to what, guys? Paralysis will occur. But my students are actually getting confused in the exam. Sir, will it be ipsilateral or contralateral? Now you can see in our diagram very, very clearly, my dear friend. If the injury occurs here, I mean to say if the injury occurs in the medulla oblongata, that means it is actually before the decussation. The injury is before the decussation. So whatever information is coming from above, it will be blocked here. Why? Because it is injured there. Therefore, the muscles on the other side, contralateral side, are not getting the information there. That's the reason why it will lead to contralateral hemiplegia. So if there is an injury here, it will actually lead to what, guys? Contralateral hemiplegia. If there's an injury here, it will lead to contralateral hemiplegia. I hope the concept is like crystal clear right now. Now, once you are done with this one here, let us go ahead. Ventral aspect of the brainstem has been completed with respect to all the cranial nerves. Now, moving ahead, in this diagram, you are able to see there's a crossing here, and this crossing here will be referred to as optic chiasma. Followed by that, this one here is optic tract here and optic tract here. And this is cerebral peduncle here and the cerebral peduncle here. Perfect. Now, in between this optic chiasma, optic tract and cerebral peduncle, you are able to appreciate one depression there, and that is referred to as interpeduncular fossa. The name is very much meaningful there. It is interpeduncular fossa. In between the two peduncles, there is interpeduncular fossa. And now you need to learn like what are the contents of interpeduncular fossa. Of course, you are able to see it very clearly here. Number 1, there will be infundibulum here. I told you pituitary gland is attached with the help of the infundibulum, or else it is also referred to as the pituitary stalk also. Along with that infundibulum, we are able to appreciate the tuber cinereum. Then these two bodies here will be the mammillary body and mammillary body here. And then there will be posterior perforated substance here. Of course, this is the third cranial nerve. Crystal clear concept, no need to mug up at all. Now you can clearly see it's written here. What will be the contents of interpeduncular fossa? Infundibulum along with the tuber cinereum, the mammillary bodies, and then the posterior perforated substance, and then the cranial nerve number 3. Now, one more question that has been asked in the INI-CET exam. Let's see. Common sense, my dear friend. If there is a posterior perforated substance here, obviously there should be anterior perforated substance also. Of course, there is an anterior perforated substance present here. Now, this one here will be the anterior perforated substance. Now, in your exam, in your INI-CET exam, they've actually asked the boundaries of this one here. Now, what are the boundaries of this one? On the medial side. On the medial side, you're able to appreciate the optic chiasma here. Posteriorly, you're able to see the optic tract here. Perfect. These two are very much easier. But what is there on the lateral aspect of this one? So if this is the anterior perforated substance, what is there on the lateral side of this one? Remember, on the lateral side, you'll be having the opening of that insula that is referred to as Lyman insulae. Okay, so on the lateral side, you'll be having Lyman insulae. And this was actually asked in the INI-CET exam. So I repeat again, just excuse me guys. So this perforated substance here will be the anterior perforated substance. On the medial side, you're able to see the optic chiasma. Posteriorly, there'll be optic tract. And on the lateral side, there will be Lyman insulae here. Okay. Now, that is all about the ventral aspect of the brainstem here, sir. Ventral aspect of the brainstem. Fine. Just give me a minute. You people revise this one. I'll be back. Now let's continue. Once you are done with the ventral aspect of the brainstem, my dear friends, let us turn this back and let us see the dorsal aspect of the brainstem. Now on the dorsal aspect of the brainstem, behind the midbrain, you're able to see the two superior colliculi here. And then there will be two inferior colliculi. Now all these four colliculi, like two superior colliculi and two inferior colliculi, together they are like four bodies here. And all these four bodies are together referred to as corpora quadrigemina. Now, once you are done with this one, I told you very clearly from the midbrain, two nerves are going to begin. One is your third one and another nerve will be the fourth one. Fine. Recently in one of the INI-CET exam, exactly this image was given. And in that image, there was an arrow mark here and you have to identify this nerve. And this nerve, I told you, it is the only cranial nerve having dorsal origin. And this one will be the trochlear nerve, that is your fourth nerve. Done. Now after completing like behind the midbrain, what do you have behind the pons and medulla oblongata? Now behind the pons and medulla oblongata, you are able to see elevation here. Actually that is a floor of the fourth ventricle. Now this entire thing here will be the floor of the fourth ventricle here. And that will be rhomboid shape. That is why it is also referred to as rhomboid fossa. Now in the floor of the fourth ventricle, you are able to see here that there will be elevation. In this elevation here, that is known as facial colliculus here. And then this elevation here will be the vestibular area here. And then there will be hypoglossal triangle and hypoglossal triangle here. And vagal triangle and vagal triangle here. So, vagal triangle here, sir. Okay. Now you need to learn what is the reason for this one. Remember, the vagal triangle is actually formed due to the vagus nucleus. The 10th nucleus. Okay, be careful, I'm writing nucleus there, not the nerve. Okay, hypoglossal triangle, it is actually formed due to the hypoglossal nucleus, that is a 12th nucleus. Similarly, vestibular area, that will be formed due to the eighth nucleus, that is the vestibulocochlear nucleus. Okay, now till here, I request you don't even learn. Examiner will never ask you. Always, study very smartly here. Think according to the mindset of the examiner. Already उसके नाम में ही लिखा है. It is already there in the name itself. Vagal triangle ये elevated क्यों है? अगर आप इसके नीचे देखोगे तो वहां पर आपको vagus nucleus नजर आएगा. Okay. तो vagal triangle is formed due to vagus nucleus. Hypoglossal triangle is formed due to hypoglossal nucleus. Similarly, vestibular area is going to form due to the vestibulocochlear nucleus. ये examiner आपको कभी भी नहीं पूछेगा. Forget about that one. Now, in this diagram, my dear friend, the most important thing will be the facial colliculus. And this is actually formed due to the sixth nucleus. And this is the thing for which I'm actually teaching you. This is important. Facial colliculus is not formed due to the facial nucleus. It's actually formed due to the abducens nucleus, the sixth nucleus, not the facial one, sir. Fine. Now again the same thing in your INI-CET exam. This image was given, and in the image there was an arrow mark here, and there is an injury here. Now, if there is an injury at the facial colliculus, then what is going to happen? Remember, facial colliculus, why the name is given like that? It is formed due to the abducens nucleus. The nucleus will be abducens nucleus there, but the facial nerve is going to take a turn around that one. Now, because the facial nerve is taking a turn around that one, that is the reason why that is given the name as facial colliculus. Okay. That is known as the facial colliculus there, guys. Okay. Now, if there is an injury at this one here, then what is going to happen? If there is an injury at this one, then what is going to happen there? Yes, of course, my dear friends, remember, first of all, the facial nerve is getting injured, not the nucleus. Yes. Please remember that, Himanshu, it is not the lateral rectus involved. Nerve injury hogi pehle. हाँ. मान लो कि this is the sixth nucleus here. But what is going to happen? From the seventh nucleus, the seventh nerve is coming, and seventh nerve is going to take a turn around this one here. तभी तो elevation form हो रहा है यहाँ पर. This elevation is getting formed here. So if there is an injury at the facial colliculus, remember, sixth nucleus will not be injured first. It is the seventh nerve that will be injured first here. So if seventh nerve is injured, we know very well the seventh nerve is the one which will be supplying to all the muscles of the face, and that will be leading to the paralysis of muscles of facial expression. Paralysis of the muscles of facial expression. So, are you clear with this one here? चलिए सर आगे बढ़ेंगे. Shall we go ahead now? So in the floor of the fourth ventricle, the main thing to learn here is about the facial colliculus. Now apart from that, what is going to form the roof of the fourth ventricle? Remember, it is formed by superior medullary velum and inferior medullary velum. The only one point that you have to remember here is superior medullary velum will be a nervous tissue, whereas the inferior medullary velum will be the non-nervous tissue. Superior medullary velum will be a nervous tissue, whereas the inferior medullary velum will be the non-nervous tissue. Please remember that one. And then apart from that, in this diagram, you're able to see the superior fovea, where you're actually able to see the bluish pigmented substance here. Now it is actually about this one here. This is the superior fovea. This end here will be the superior fovea, and where you'll be able to find the bluish gray pigmented area. That area is actually referred to as locus ceruleus. That is referred to as locus ceruleus here, sir. Is it okay? Done? Next one, sir. Now, once this question was actually asked in your exam, this image was given and there was an arrow mark here. And at the arrow mark structure, you have to identify which cranial nerve will be actually visible. Now remember, if the arrow mark is behind the midbrain, the nerve that is visible will be the fourth nerve. And if the arrow mark is behind the pons here, that nerve here will be the seventh nerve. So please be careful there with that arrow mark. If the arrow mark is given behind the midbrain, then it has to be the fourth nerve. And if the arrow mark is like behind the pons, then it has to be the seventh nerve, my dear friend. Okay. Now, once you are done with this one here, yes, my dear friends, we are done with the brainstem ventral aspect and dorsal aspect of the brainstem. And now what we are going to do is we are going to take the transverse section of this brainstem. There is a transverse section of midbrain, pons, and medulla oblongata. And along with that, we are going to see the syndromes related with this one here, sir. Okay ना? ये बहुत important part है. यहाँ पर ध्यान से देखिएगा. Okay. Thank you. Now, first of all, when you're going to take a transverse section of midbrain, this is how the diagram looks like. Now, in this diagram, this is the ventral aspect here, and this one here will be the dorsal aspect. Now, on the ventral aspect, you're able to see a depression here, that is interpeduncular fossa. And on the dorsal aspect, there will be the colliculi present here. Okay, so there will be the colliculi present here, sir. And in the middle, there'll be a duct here, and we know very well this one here will be the aqueduct of Sylvius or cerebral aqueduct. Till here, my student knows very well. Now, my dear friends, remember this aqueduct is a very important landmark. Why? Because whatever part that you are able to see behind the aqueduct here, this part is actually referred to as tectum. The part in the middle here, this one will be referred to as tegmentum. And then this part, definitely it has to be the cerebral peduncle. So when you take the transverse section of the midbrain, the transverse section of midbrain is actually divided to like three parts here: the tectum, tegmentum, and the cerebral peduncle. So what is the landmark here? The landmark here will be the aqueduct. Behind the aqueduct, whatever part is visible here, that is tectum here. And in the middle here, this part is tegmentum here. And in the front, there will be cerebral peduncle. Now remember, in the cerebral peduncle, there will be a gray matter here. This gray matter will be the substantia nigra. Substantia nigra. In front of that, this white matter present here will be the crus cerebri. This is the place from where the tracts are actually passing from here, sir. Now, out of all the tracts which are passing from here, please remember, if you divide this crus cerebri into like three parts, so in the middle part, there will be the pyramidal tract passing from here, which is also referred to as corticospinal tract. The pyramidal tract is going to pass from here. That is also referred to as corticospinal tract. That is something important to remember here. Now I already told you that in the midbrain or from the midbrain, two nerves are going to originate. One is your third nerve, another one is a fourth nerve. Third nerve and fourth nerve are going to originate from here. But remember, third nerve is given at the level of superior colliculus, whereas fourth nerve will be given at the level of inferior colliculus. So now, suppose if we are at the level of superior colliculus here. So at the level of superior colliculus, which nerve is going to begin from here? That is your third nerve. So cranial nerve number 3 is going to begin at the level of, yes, superior colliculus here. Apart from that, one more thing that you have to remember, there will be a big nucleus present here, which will be appearing red in color, and that nucleus will be the red nucleus here. So this nucleus here will be the red nucleus here, sir. And then you will be able to appreciate, yes, the lemnisci. I hope you all have learned about the ascending tracts. The ascending tracts are going to ascend up, and when they are passing through the brainstem part, that will be actually forming the lemniscus. Okay, so there will be like lemnisci passing from here. Now, my dear friend, remember, there will be one lemniscus towards the medial side. Of course, that will be the medial lemniscus. No doubt about that one. There will be the medial lemniscus present over here. And then you'll be having the trigeminal lemniscus in the middle. Trigeminal lemniscus. And then there will be one more here, that will be the spinal lemniscus. Now try to recall, spinal lemniscus is actually the continuation of lateral spinothalamic tract. Spinal lemniscus is actually the continuation of lateral spinothalamic tract. Of course, that has to be towards the lateral side. Now at this level, we'll not be able to appreciate the lateral lemniscus. That is not visible here. Why? Because try to recall, lateral lemniscus is actually a part of your which pathway? Auditory pathway. And because it is actually a part of your auditory pathway over there, So please remember that is actually going to go to the inferior colliculi. The fibers are going to inferior colliculi. That is the reason why at the level of superior colliculi, when you are taking a section, those fibers will not be visible. That lemniscus will not be visible. So lateral lemniscus, I repeat again, it is actually a part of your auditory pathway. Now, because it is a part of your auditory pathway, remember the fibers are going to go to the inferior colliculi, and from the inferior colliculi they're going to continue there. That is the reason why when you are going to take a section at the level of superior colliculus, remember the lateral lemniscus will not be visible. Perfect. Now these are all the structures that you have to know in the midbrain. Fine. And now let us see all the syndromes related with the midbrain one by one. All the midbrain syndromes, let us see them one by one. Are you ready? Yeah, Ashutosh, I have been drinking a lot of water, following all that maneuver that you're telling me. Now let us see all the syndromes related with the midbrain here. So now everyone here, after learning the transverse section of the midbrain here, let us learn all the syndromes related with the midbrain one by one. Now suppose if this part of the midbrain is involved, if this much part of the midbrain is involved here, I mean to say you can clearly see the corticospinal tract is getting involved here, as well as you're also able to see the third nerve is getting involved here. And then along with that, you will also have the UMN, upper motor neurons of seventh nerve passing from here. So third nerve, corticospinal tract and upper motor neurons of seventh nerve are involved here. What is going to happen? If third nerve is involved, we know very well there is a classical thing, the third nerve palsy will occur on the ipsilateral side. See, remember, whenever nerve is getting involved here, don't even try to think whether it is contralateral or ipsilateral. The moment you are listening the word as nerve, it has to be of the same side, on the same side there. Okay. So remember, if the third nerve is involved, it'll be ipsilateral third nerve palsy. It'll be ipsilateral third nerve palsy there, guys. Okay. Guys, just give me like 2-3 minutes of time. Let me see if I can just settle this one here. So let's take a small break here and then I'll come back. Okay. Because we are dealing with an important thing here, syndromes and all. So let's do it properly. Fine. Welcome back, everyone. Welcome back, everyone. Am I audible to and visible to all of you? Yes, that's good. That's good. That's fine, but this is something. Uh, the reason why I'm smiling here is like there's something very awkward reason here that in the middle of the class this thing is happening, and in the beginning I think it was like fine, the class was going fine, but suddenly this is happening now. Yeah, Nitya, actually I'm fine, but suddenly this in the middle of the class hiccups actually got started, and because of that this disturbance is happening. What we'll do, shall we continue, or shall we stop here, or shall we do it at some other time? Fine, fine. We'll actually do it at it would be better some other time because it's like continuously happening. I tried everything that you people told me. Fine, fine, fine. No problem. We'll schedule it like tomorrow or day after tomorrow. I'll just check the schedule of other sessions also. I think other faculties are also having a session because I planned this session to be like a wonderful session for you people, so that you know entire anatomy will be covered for you for your INI-CET exam. Entire anatomy will be done. So all the clinical things, and also as you're able to see here, we were also about to discuss all the syndromes and all. No, no, no. Okay, fine, fine. So we'll schedule. Okay, we'll schedule either tomorrow. ओके ओके ओके, ब्रेक आने पे रिदम ब्रेक, हाँ वही 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 हिमांशु, इसीलिए अपन उसको ना प्लान करते हैं. ओके फाइन फाइन, आई टेक केयर अबाउट दैट वन. ओके फाइन फाइन, Ujjwal Sharma, we can continue from the midbrain sections only. Fine, from this midbrain sections we can actually start. Okay, okay then. Take care then. Okay, na? We'll continue tomorrow. Thank you for that one.